Fantastic. Okay. It never fails to amaze me that we often neglect the skill, the most important skill that we need to enable change to happen and get the outcome that we need. So I'm just going to ask you now, can you just look to your left or your right and say good morning to the person next to you? Okay, thank you very much. How many people are from a clinical background in the audience? Okay. How many people from IT? Suppliers? Any other profession in the NHS? Okay. Very good. You've all got a role to play in the next part of the discussion that I'm about to have. As we move through my presentation, the square in the middle is one of us. Quick test. Anybody know who that lady is? Right. That gentleman? Oh, very good. Oh, brilliant. Goodness me. She's not for turning. Louder. Louder, please. Okay, the more difficult question now. What have all these people got in common? They're all leaders. And leadership is key to enabling the change that's required within the NHS. And it's really interesting. Chris and I was just chatting this morning over coffee, and I said, you know, the NHS, sometimes we're not proud of what we've done. You know, we somehow want to bash the NHS, or we want to bash the staff, the clinical people in there, we want to make transparency, we want to open doors. But actually we should be proud of what we've done. There's a lot of leaders, and you are those leaders in the room, that actually make things happen here. So I want to talk to you specifically about what we've been doing at Sherwood and my organisation, which is a hosted shared service within Sherwood Forest Hospitals, who again is one of those trusts that are struggling financially, not alone, but what we want to do is to drive quality for all. And that's our agenda by creating leaders in the organisation. I'm sure you've all got your own initiatives that you're working with in order to achieve that agenda, but it's just important to note that recognising the role that people have to play in this is key. So where we are in that concentrated, I haven't got a point about the concentrated dots there, we've got quite a few organisations which we support, not necessarily just Sherwood Forest as an acute trust, but also the CCG Commissioning Trust, a social enterprise, along with public health and some of the area teams, or whatever name they're going to become in the future. The idea that I wanted to kind of pose to you at the moment is that partnerships and shared working is something that IT shared services have been trying to achieve for a long time, but we find it very difficult to make happen. And the reason for that, and I propose the hypothesis is quite simple, is because it's the tail wagging the dog. Because actually, whether we save and try to create change in an IT department is irrelevant, because 95% of the resources that we're consuming and the demand for NHS services is within the clinical consumption area. So we have to change that dynamic. And if we're going to close the gap between the £30 billion that we currently predicted spend that we need to manage the demand that's coming in, we need to do something different. And that's why I'm looking to you guys as leaders. I also want to propose that my organisation as an IT department needs to kind of evolve. We need to think about, actually, who cares about the size of my data centre? How many terabytes have got in it? How many servers? Nobody knows. Size is not important. In fact, we don't want anything. We need to just consume it, just like you. So we've created something called a desktop on demand, which means you're able to actually just go on demand and call up a desktop that gives you access to the clinical information systems and all the applications that you need. But there's still a long way to go. And I think my team is made up of multi-professional employees, some IT staff, clinicians, community staff, all across the patch. And our objective and mission is to transfer care through technology. And to be honest, it's difficult because change is happening all around us, and we have to kind of get on board the right agendas to make things happen. But the energy that we use for transformation is key. So got to keep upbeat, got to keep going, got to have a shared vision, got to understand why we're doing things. Yesterday was really interesting because I was actually here in the King's Funds, and it was a kind of inaugural CIO's introduction to the new launch of the Jeremy Hunt paper, which is more kind of a personalised health and care framework than it is actually a strategy. So what I've done today is just summarise some of the key messages that come out of that strategy, but I think actually enable us to harness the technology that we've got here from Winscribe, from all the other supporting suppliers that are around as well. So Philips and Olympus can have a role in this new strategy, bringing together the needs of patients. So just remember, it's not a strategy. What it does do, it gives you the IT elements of it, bringing it closer to NHS policy. So there's lots of things that says by 2015, all patients will be able to access their record. I had to read it twice, because by 2015, by my recollection, that's just next year. Okay, don't panic, it's fine. No, IT, we've got it covered, don't worry. Okay, and the interesting thing about this that I read as well is you get into the detail of the further documents. It's a very easy read, so if you ever got insomnia or anything, it's not a complete page, so I can just pick it up, it works. There's IT targets set in there as well, so it's really interesting. So from my IT colleagues, I'm just going to say to you this time, be warned, because often we use that excuse of, well, the technology's there, it's already ready to go, actually it's just the clinicians or the, but I think we need to be warned on that. We need to remember that the £30 billion gap is not going to go away, because it's not a real £30 million gap, it's actually a predicted one, and actually the demand in which consumption of services is not actually accurately reflected. So for example, the consumerisation of health is increasing the demand, long-term conditions, access, bringing care closer to the home, the need for me to be able to access the doctor when I want to, are all increasing the demands on NHS and clinicians as a whole. So therefore, at the moment, a predicted £30 million gap is but actually, how real is that? So we really do have to do something different. But what the good news is, and I would say this anyway, is that actually not only are we just looking for the opportunity to put the patient or the consumer in the middle of our services, he's saying technology is the enabler to do that. So I've got a job for life, I'm fine now, I'm comfortable, I'm retired. Yeah. The only worrying thing is he starts talking about these things again by 2018. I know I'm young, but I just think we need to just assess the national picture on this and see where it's taking us. So I've just pulled out something that was in the HSJ very recently, and it talks about the skills gap, isn't it? And it's saying 91% lack the knowledge of IT, skills and ability to implement it in order to make this happen. So, thinking of what's happened at Sherwood, and I take my hat off to the team, some of the key factors that I think made a difference to the success of the implementation is that senior managers bought into it and said this must happen, helping out with comorbidity, helping out with mortality rates, helping out with efficiency processes. There was a drive from the top to do that. Senior clinicians got behind it as well when their specialty came on board. What I find interesting about clinicians, present company accepted, is they don't always want to be first, and sometimes it's only the IT literate ones that will jump into first, and you don't actually get an accurate picture of the implementation there because they're IT kind of savvy. So you just need to wait for the groundswell. So you start slow, developing, and then build up, and then before you know it, the clinicians themselves are actually saying, you know what, we haven't got trauma orthopedics on, you know what, we haven't got surgery on, yours, you know what, and there's then a groundswell and a movement. And I don't know if anybody's seen that YouTube video where there's a movement, where there's one man, I must show you, I must bring it next time, Chris, and show you, it's quite interesting. One man sets off a movement, and that's what we call leadership in the follow. One person has a vision, we drive a bit behind it, and then suddenly everybody else is following. So you must do that. I think the challenge for diversity of IT systems and the actual interoperability between IT vendors will go away. It talks into the framework as well that what we will see, mandation of open APIs. That means systems that talk to each other, and that means we won't be able to buy anything as an IT department unless the system will talk to other systems and trust. That's great news for me. How many times do we get suppliers and please can we interface without you? No, that goes away now. One of the conditions is we will have to interface with other systems. But the great news as well is that actually on the other side of this, we've always had a desire in terms of working with suppliers, but we've never articulated what it is we actually want. I think this document goes a long way towards helping describe that actually we want open technology that allows us to do what we want for the patient when they ask us to do. And I think the partnership between the NHS and the suppliers will get a lot stronger moving forward. I'll just run through some thoughts about this 2018, we've got to be paperless. We've been trying to do this for the last 30 years, and the fact that we've now made a commitment that we're going to give patient access to their records in 2015, first one, and by 2018 we'll be paperless, is going to require a seismic shift in understanding actually that we have a role, that it's us that need to make it happen. It's not about the technology, and I'm delighted to be able to see some of this technology, speech with the new release. I think that will make a difference in terms of EPR enabled, because we're behind. Other sectors are moving forward, but the NHS is slightly behind in that. So this slide really just depicts that there's three things that need to happen in order to make it happen. First of all, we need to digitise everything. It's as simple as that. We can't hang on to paper while you're shifting paper around. You just have an ambition that, and again, remember to start small and build big. Momentum will come. But also, we need to change the workflows. That is really interesting. I've not seen Chris's slides before, but that diagram of whoever drew that amazing diagram, all the workflows, it doesn't feel real. It feels like it's artificial, that you just put it there for effect. But actually it is, isn't it? If you think about the resources and consumption and the effort made to getting the patient to an outpatient clinic and then back for a follow-up, it's an enormous amount of effort. So we do need to think about how we can change our workflow and our processes in order to make us much more efficient and effective in a way. And then we need to think about how we can operate without paper. So he says that with his iPad for these notes, and then backup paper just in case. So there is something about not just blaming clinicians or managers in hospitals and that, but also our IT guys. How do we make things resilient, that actually we feel comfortable that we've designed the workflow so that if I haven't got a piece of paper, I can still pick up where I need to be in the notes as well. So there's a lot of kind of thinking and that we need to go through there. And I just put at the bottom that I think Winscribe is moving towards that thinking, and I'm really excited, I think, to be able to say that once we've got a speech inside EPRs and we start removing some of the paper, that is a significant step forward. So a little bit about Sherwood, because I can't stay here. I know there's some people in the audience from Sherwood, and I can't stand here and take the glory for all their success and all the hard work that they did, but I'm going to do anyway. So I just want to say what we've done is we've deployed across 5 sites into 24 specialties. We've got ePro, clinical correspondence rolled out across the trust. I'm looking forward to the upgrade of that. What did that do for us? Did it make a difference? Well, yes, we think so. There was a reduction in time required to produce the letters, and remember, we're trusting special measures that required a lot of, basically had a lot of scrutiny over our processes. We increased efficiency, reduced typing backlog. The Winscribe was well received after a while. And I think that's an important point to note, because nobody's going to turn up into a clinician's office and say, by the way, using this electronic system now, smile at me and get on with it, because it doesn't work. They have to see what's in it for them and how it works, essentially. We know that this is producing better patient experience, and really, on a serious note, I do like to thank the team from NHIS, that's my organisation, and Sherwood Forest, who worked together to make this happen, because without that joined up thinking, it's not going to happen. Without that collaboration, without the hard work, without the dedication, without the onboarding, the stakeholder management, and the leadership, it doesn't happen. So I'm just going to leave you some final thoughts, really. And it's really been a pleasure sharing my thoughts with you, because I think going on for the rest of the day in the presentation is going to be important. You're going to see some exciting things that will work. But also, I just wanted to remind you that we started the presentation with leadership is key. And that means doing something different and doing something that is amazing. And this guy did something amazing, because you know what? If he stood around and just spoke to clinicians and said, spoke to people and says, what do you want? He would have asked for faster roses, but no, he decided to do something different. So please take out of today, take your leadership skills, do something amazing, and do something different to digitise the NHS. Thank you.